There aren't any overwhelming signs. It usually begins with pain, fever and lethargy, symptoms any parent would pass off as usual illnesses of childhood. Devinder felt the ground beneath him disappear when the doctor said his 2-year-old daughter has cancer. That was last month. He's finding it hard to come to terms with what lies ahead.
It's very shocking for the family जिनकी एक ही बेटी है और 2 साल का बच्चा, तो उसका सुन के तो ये तो क्लियर है ब्लड कैंसर है. ब्लड में भी 2-3 टाइप के कैंसर होते हैं, तो वो बोन मैरो होता है बच्चों का, हड्डियों का, उसके बाद पता चलता है.
He hasn't had the heart to tell his wife the truth. She believes Diksha is being treated for dengue. In India, 50,000 children are diagnosed every year with cancer. The National Cancer Registry reports that childhood cancers in India are on the rise. The most common childhood cancers are leukemia or blood cancer, brain and central nervous system tumors, neuroblastoma that usually arises in and around the adrenal glands, lymphoma that develops in the lymph nodes and the lymphatic system, retinoblastoma or eye cancer, and bone cancer. Dr. Naveen Dang's pathology lab in the capital is a primary center for detection.
Unfortunately, over years, I do not know why, the number of patients coming with cancers or the number of patients we are diagnosing with cancers, especially the number of children whom we are diagnosing with cancers, is going increasing with time to time. There will be hardly a patient of cancer whom we would diagnose, especially that of a pediatric cancer. But now, surprisingly, sadly, I can say with a very heavy heart that it is practically every alternate day, every other day, that you diagnose a patient of cancer. That to a child having cancer.
Unlike cancers in adults, childhood cancers are biologically different. The factors that cause malignancies in children are largely unknown. Hearteningly, unlike cancers in adults, cure rates among children with cancer are 70 to 90% if diagnosed early. Early detection is the key. Most children with cancer die because of late diagnosis, the extremely high cost of cure, and the overburdened healthcare system.
Once we refer them there, or they have to go to government hospital, the long queues, the lines, the cost, and all these things play down so heavily on the patient that many a time they drop out from the treatment itself and the child just languishes and passes away.
The progress in pediatric oncology is one of the biggest success stories in cancer cure in the last millennium. The 5-year survival post-diagnosis for all pediatric cancers is now 75 to 80%. But India has less than 50 pediatric oncologists, which means in most cancer centers, adult oncologists treat children.
We may not be able to overcome the surge in adulthood cancers today, but it is a shame that we cannot effectively treat childhood cancers which are highly curable. A lack of specialists, poverty, lack of awareness and social stigmas are causing us to lose a battle which ironically is very winnable.
Doctors told 10-year-old Khushmeet's parents that her leg would have to be amputated to control her bone cancer. They didn't agree. Their lack of consent was as embedded in misplaced hope as is the idea of a girl child who has to grow up to be socially acceptable in every way. There were, of course, concerns about marriage in future.
There can be stigma around different aspects of the disease. For example, if you have to cut off a limb to save a life, there's stigma around having a child without a limb. And sometimes that stigma plays a bigger role than what can actually save the child's life.
Khushmeet's parents travelled all over North India in search of an alternative cure.
इसका ऑपरेशन हुआ टांग का, तो उसके बाद इसकी ऑपरेशन में इसकी रोड डाल दी डॉक्टर ने, ऑपरेशन ठीक हो गया जी, तो छुट्टी दे दी डॉक्टर ने भी घर चले जाओ। तो घर में ठीक थी, बिल्कुल चलने फिरने लगी थी, कोई दिक्कत वाली बात नहीं थी। उसके बाद फिर इसको स्पेलिंग आने लगी, इसको सूजन हो गया टांग में जी। तो फिर डॉक्टर के पास लेके जिसने ऑपरेशन करा था, उसने रिपोर्ट करके मैंने आपको बताया भी इसको दोबारा फिर आगे बीमारी, इसका ये टांग निकालनी पड़ेगी दोबारा। उस टाइम हमारे को दिल नहीं माना भी इसको शायद और हॉस्पिटल में दिखाएं, शायद इसकी टांग बच जाए। हम पर यहाँ लेके आ गए दिल्ली में भी, तो यहाँ पर डॉक्टर ने इसका टेस्ट वगैरह करके इसकी टांग निकाल दी।
आपने काफ़ी कोशिश की?
हाँ जी, काफ़ी कोशिश की है, इसकी टांग बच जाइए, भाग दौड़ से टांग ने इसकी बच।
The delay in amputation spread the cancer. Khushmeet's lungs are affected and she coughs blood. The doctors have put her on experimental drugs and the parents are heartbroken.
डॉक्टर कह रहे हैं कि 100 में से 70% इसके छाती में बीमारी फैल चुकी है। सबको यही कहेंगे कि अपने बच्चे का इलाज करवाना चाहिए, सबको, हम भी करवा रहे हैं।
We pray for Khushmeet's health and take heart in Ritu's complete recovery. That's coming up next.
I am Ritu Bhalla. I am two-time cancer survivor, and my message is that childhood cancer is curable if detected on time and treated at proper cancer center. And have faith in God and courage in yourself. You will definitely beat the cancer.